Have you ever noticed that as the seasons start to change, your energy changes too? Mornings feel harder, you're more tired than usual, even when you're sleeping more. Things that didn't feel overwhelming before suddenly feels heavier or harder to care about. For some people, this happens every single year around the same time, and it's often brushed off as winter blues, stress, or just pushing through a busy season. But when these shifts start showing up in a more predictable pattern, there may be something more going on. Before we go any further, if we haven't met yet, my name is Edee, a board-certified psychiatric mental health nurse practitioner. I work with a lot of people who have noticed these seasonal changes and are wondering why their moods, energy, and motivation seem to dip at the same time every year. Today, I want to talk about seasonal affective disorder, often called SAD. If you notice that your mood tends to drop around the same time each year, especially in the fall or winter, this might apply to you. Seasonal affective disorder is a form of depression that's closely tied to changes in the season. For most people, symptoms show up during the darker, colder months and starts to ease around the spring. A smaller group experiences symptoms during the warmer months, but winter pattern SAD is by far the most common. Seasonal affective disorder often creeps in gradually. At first, days begin to feel heavier, energy dips, and everyday tasks just feels more and requires more effort than it once did. As time goes on, motivation fades, even for things that usually feel comfortable or enjoyable. Sleep stretches longer, yet despite that, rest never feels complete. Meanwhile, the mind slows down, focus slips, and thoughts can feel foggy or muted. Alongside these changes, cravings for carbs or sugar often increases, as if the body is searching for a quick source of warmth or energy. At the same time, social life tends to shrink, plans are postponed, staying in feels safer, and reaching out takes more effort than it once did. Over time, people may describe feeling slowed down, dull, or out of sync with the world around them. What stands out the most, however, is the rhythm of it all. These changes don't happen randomly. Instead, they return around the same time each year, following a familiar seasonal pattern. Because of this repetition, seasonal affective disorder can be identified, understood, and treated more clearly. Light plays a major role in what happens in the body with seasonal affective disorder. As daylight decreases, the brain chemistry starts to shift. Melatonin, which is the hormone that helps regulate sleep, rises in response to darkness. In people with SAD, melatonin levels often stay elevated longer into the day, which contributes to fatigue and sluggishness. Serotonin, which supports mood and emotional balance, is also affected. Reduced sunlight leads to lower serotonin activity, which closely links to depressive symptoms. Light also helps regulate your circadian rhythm, or your internal clock. When days get shorter, that rhythm can fall out of sync, and when the circadian system is off, sleep, appetite, energy, and mood are all affected. There are certain factors that increase the risk for seasonal affective disorder. People who live further from the equator tend to get less winter sunlight and have higher rates of SAD. A personal or family history of depression or bipolar disorder also increases the risk. Symptoms often begin in young adulthood. Women are diagnosed more often, although men tend to delay seeking care and may show up later with more severe symptoms. These patterns help to explain why SAD develops in some people and not others. Seasonal affective disorder is diagnosed as a subtype of major depressive disorder or bipolar disorder. The defining feature is a consistent seasonal pattern that lasts at least 2 years, as outlined by the American Psychiatric Association. That predictable timing helps distinguish seasonal depression from other forms of depression that don't follow a seasonal cycle. Seasonal affective disorder responds well to treatment, especially when it's addressed early. Light therapy is often one of the first treatment options. Light therapy helps to regulate melatonin, serotonin, and the circadian rhythm. Therapy also plays an important role. Cognitive behavioral therapy adapted for SAD focuses on seasonal thought patterns, reducing withdrawal behavior and creating more structure during the winter months. Planning ahead before symptoms fully set in tends to improve outcomes. Medication can also be helpful for people with moderate to severe symptoms. Antidepressants such as SSRIs help to regulate serotonin. Vitamin D is often part of the treatment plan because it plays an important role in mood regulation and overall brain function. During darker months, sunlight exposure drops, which makes it harder for the body to produce enough vitamin D on its own. As a result, lower levels are especially common in people with seasonal affective disorder. Testing can be helpful because it shows whether a true deficiency is present and helps guide safe and appropriate supplementation. When levels are low, restoring them may support energy, mood stability, and emotional resilience. It's not a standalone fix, but for many people, correcting a deficiency can ease some of the underlying strain and can make other treatments work more effectively. Daily habits play a strong supporting role. Spending time outside during daylight hours helps to reinforce the circadian rhythm. Keeping a consistent sleep schedule supports energy and mood regulation. Regular movements benefit both the physical and mental health. Balanced meal with enough protein and fiber helps stabilize energy levels. Staying socially connected matters, even when withdrawal feels easier. Often, small, structured activities come before mood improvements. Behavior changes first and mood follows. Professional support becomes especially important when symptoms start to interfere with work, parenting, or relationships. It's also important to seek support when hopelessness increases or when symptoms return each year and becomes more severe. Seasonal affective disorder follows a predictable pattern. A predictable pattern responds well to planning. With preparation, support, and appropriate treatment, seasonal affective disorder becomes manageable.